Afternoon, everyone. Thank you for joining us. We are just really lucky to have two wonderful students with us who had time in their busy schedule to join us. We have Yulissa Perez. And she is finished up her third year at UMSL and pursuing her BS in biology. She works as a Triton leader for the Office of New Student Programs. She also works as a student program manager of programming and activities for the Office of Student Involvement. And then we also have Haley Alberson.
Everybody. Yeah, now I know it.
I think someone needs to mute. Thank you. Haley is a senior here at UMSL and working towards a psychology major, child advocacy studies minor, and a neuroscience certificate. She works at MIMH as a student researcher and enjoys every minute of it. And I am just thrilled to have both students here. And I have worked with Haley maybe 2 years, at least a year, but she's just wonderful. So Yuli and Haley, thank you. And it is now your turn to speak.
Okay, like Jennifer said, thank you all for, excuse me, for coming out. I really do appreciate that. I do just want to preface this by saying this is the exact presentation that we used to present as like our final project for this class that we were in. It was just LGBTQ plus in healthcare. We learned a lot. It was a great class, and it was for the honors course because we are both in honors. But so yeah, let's get started. Okay, so first we wanted to preface by why is education in LGBTQ plus healthcare so important? So we kind of looked up some information, and studies show that LGBTQ people are less likely to have a regular healthcare provider. Lesbian and bisexual women have higher rates of breast cancer, and transgender men and women are at greater risk. LGBTQ plus people have higher rates of HPV infection and related cervical or anal cancers. And then when it comes to trust, LGBTQ plus adults trust primary care doctors and specialists about 30% less than cisgender heterosexual people. LGBTQ plus adults also said they trusted the general healthcare system 94% less and insurance companies 100% less. So we find that teaching these LGBTQ plus things is very important to educate. One of the goals of this course that we are creating is not to push any agenda or something like that. It is more to educate on specific needs of the community. So first, we needed to make a plan for our certificate. Just a little background information, our whole goal for this was to create a certificate to implement at UMSL's program. So it would be a certificate in LGBTQ plus healthcare studies. And this would be used as, a certificate is, whether that be you're a psychology major, a nursing major, something like that. So first we had to select whether it needed to be a minor, a major, or a certificate. And overall, we chose that a certificate would be the best suited for UMSL. We needed to talk to staff, see what we needed to accomplish and do. And then we needed to plan coursework and a curriculum to present, because you can't go up and talk to staff without having a general idea. And then we wanted to survey Triton leaders and kind of get the UMSL community's ideas and thoughts of our program and see if it would even be something that UMSL students would be interested in. And then we also took some quotes from students. And then this is kind of our ideas of how would a certificate help. So first, we wanted to mention education. It would increase LGBTQ plus education and awareness. We hope it would help trust and maybe provide help to LGBTQ plus and maybe trusting their healthcare provider more. Affirming, this would teach LGBTQ plus affirming care, which is a necessity for LGBTQ plus. Comfortability, this would help anyone in the community feel more comfortable with their healthcare provider. And then diversity, it could help with diversity on campus and also help show how UMSL supports diversity.
So after we decided to make a certificate because we saw that there was like different health disparities, and then in order to counteract against that, after making a certificate, we also looked up like different examples of other universities that had these programs. So here we just have two examples that we kind of based ours off of. They're each 18 credit courses, so it would round out to about a semester for these certificate programs. And they had like mental health type classes, health policy, like independent studies, topics in LGBT health, and things like that. So from here, we were able to kind of see what they were fulfilling, what they weren't fulfilling, and what we could add to them. So just like we thought there are more specialty courses that we could add, or to like diversify the courses as well, so they weren't so just like aligned with the basics of it. So then after that, like Haley mentioned, we had to talk to staff and faculty at UMSL. So through our institution, we were able to talk to different people to see what we needed and how to add to the curriculum that we were working on. So we talked to someone named Amber Reinhardt, and she's the Associate Provost for Academic Affairs. And she explained how the curriculum at UMSL is faculty owned. So basically, we could create the curriculum, but the faculty would have to vote on it, see if it's needed, see what's lacking, what it has, just like the potential for it. So we would have to go through them first just to see if the certificate could get implemented. And then she also talked to us about the curriculum map. So we would have to have introductory courses, like middle courses, and then a capstone course at the end. And she also walked us through the way that UMSL is set up is that we have different colleges based on your major. So we had to pick where we wanted our certificate to live. And we really wanted to aim for the College of Nursing. But there's also like the College of Arts and Sciences, things like that that we could have also picked, but we aimed for the College of Nursing because our process was that we wanted like healthcare workers to be able to have this extra knowledge because they're the ones that are going to go out into the world and help people through these like health disparities. And then we also spoke to Dakota Miller, who's the former LGBTQ plus and diversity coordinator at UMSL. And he walked us through when we made our curriculum, we would need like course objectives. So what you would learn at the end of it, what you would gain basically. He walked us through some potential courseworks that he hadn't seen. So like some classes that we would need to implement or that he thought were important also through his personal experience as a member of the community. He was talking to us about his experiences and what he thinks are lacking in the healthcare departments. And everything like that. So he was really a jumping off point for the curriculum that we created. And then we also talked to Elise Schaller, and she's the Associate Dean of Academic Programs, and she also has connections in the College of Nursing. So talking to her was really beneficial to us. So we showed her the layout that we had so far that I'll be showing in a little bit. And she recommended that we should branch out to different departments and not just the College of Nursing. So like existing UMSL courses that would fall into communications, anthropology, psychology, anything like that. And her main process for that was that so that people didn't have to be like nursing majors to be able to take the certificate, so that people that just enroll into UMSL and they're interested in the certificate would be able to take this because it would have different departments that you would be able to go through. And then we've been talking a lot about like our curriculum and our certificate. So here's what we actually came up with. So this is called the Pride Health Certificate, and its main goal is to elevate standards in LGBTQ plus inclusive care. So you'll see some courses have numbers and like specific titles. Those are the existing UMSL courses. So the ones that Elise recommended to us that would be beneficial for their certificate. So these have existing syllabi and course objectives. So that's what's listed under that. And then the courses that have kind of the X's where the number should be are courses that Haley and I thought would be beneficial to introduce into the curriculum. So we came up with our own learning objectives, and then we have an example syllabus for these types of classes also. I can pull this up later if anyone has any questions about it, but this was what we came up with, and this is what we presented to the faculty that we talked to, and then we presented this to our class, and we also sent this out with our surveys that we'll talk about the results later of, but this is what everyone was really looking at when we asked them if they thought this was needed, what they thought we should add, anything like that. And then for the courses that we wanted to introduce that weren't available at UMSL are these two. So we have a nursing class, and then this would be like a 5-credit class, requires a C to pass. We have like potential materials for it. So for the class that we took, we really had to get our materials along the way because there's no set coursework for it. So we thought that this would be beneficial for this type of class because it's something that you learn along the way. So in this class, you would categorize STDs and HIVs, and like understanding things before you diagnose them, because we saw that a big disparity in healthcare right now was that healthcare professionals would automatically diagnose somebody just because of their like sexual preferences. So we really wanted to emphasize that in this class, to understand things and ask things before you diagnose something, and then to categorize like STDs and HIVs appropriately. Identifying hormone therapy, utilizing bedside manner, which again goes back to just like pronouns, asking before you diagnose, just things like that. Understanding and analyzing transgender affirming surgeries, because there are a lot of those that are evolving. So we'd have to be able to have healthcare professionals that understand how those things work and how they evolve also. But this would be a capstone course. So it would be like the last course you would take after learning everything else, all like our introductory material and courses and everything like that. And then we also have a psych course. The objectives for this one would be like understanding mental health in general, as well as how it is different for those in queer communities, identifying health disparities through queer lenses, identifying why this is significant, like why this is a significant health disparity and how to counteract it, and then investigating how to implement solutions, because we did touch on that in our honors course, but this would mainly be focused on it. And then there's just like a description of the course. For this one, I actually found a textbook that I thought would help. And then the course would be 3 hours. So those are basically the mock-ups of the syllabi that we came up with.
Okay, and then we got our feedback. This was a survey that we sent out not only to Triton leaders, but also people in our class and really anyone who would fill it out. So I'm not sure how well you can exactly see the feedback, but the overall question was, do you feel like this course should be implemented? And the one on the right is, do you think people would take this course? We got some mixed reviews. On the first one, we got 66% would say yes. And then on the other one, 50% would say yes. And then we got some regular responses that had full answers. So it kind of made it in that green category, the yellow category. And in those, it was more of depends. I think some would, some wouldn't, and some people only like certain parts of our certificate, things like that. We also got some suggestions about a historical or sociology class that shows the timeline, which would be really cool. And then another suggested was the implementation of respect for someone and their beliefs, even when they don't align with your own. And also, if you can see that, we only got 6 responses. So our goal in the future is to get more responses as we continue pushing this.
And then just before moving on, I just wanted to say, we mentioned like Triton leaders, and they are basically like tour guides at the school. So they know all the current information about UMSL because they have to give tours to potential students. So that's why we picked them to survey, since they're up to date with everything that goes on in the institution. We really wanted their feedback since they're more information oriented, so they would know like kind of what majors are coming in for the potential students. And if we have more like nursing science majors, they would know also if they're interested in things like this, or if they ask about our LGBTQ clubs or anything like that. So that's just why we surveyed them, and they serve as like the try-in leaders and like they serve as the tour guides and like orientation leaders. So that's just why we surveyed them.
They're pretty good representation for UMSL students. And then, so our future plans, we are still working on this, but pretty much as of the end of the class, our goal was to send the survey out to more people, such as the class we were in. We need to talk more with the nursing department, talk with faculty to try and implement the program, make sure that there are staff to teach these courses, which is really important. And then if the certificate is implemented, we want to see if students take these classes and obtain more feedback on our curriculum.
And then I just got quotes from different students that I know. So one student was named Samantha, and she thought that education in the medical field concerning queer issues is crucial for equitable treatment and care. So we thought that that was just very impactful in itself, and that shows that we do need something like this to be implemented. Latrice, on the other side, she's actually a psychology major, so we just asked for her input as well, because we did have some psychology courses on our curriculum. And then she said both of these classes I think are beneficial. So the ones that we added, she thinks they're beneficial for people because if they're wanting to know more to help the LGBTQ plus community, and it'll just help better understand and relate to their life and have like effective help towards them. And then at the bottom, we have someone that's actually in the community. So Jay says he thinks it would be very beneficial to have this certificate for people in healthcare. And this would also get people to work directly with the queer communities. And then learning about the queer community and their needs will help the healthcare workers understand better and then in turn serve them better. So we just kind of got those also to get their feedback.
Yep, and that is pretty much it for our certificate. That is a little QR code for our survey. You guys are free to take it if you would like to suggest anything. We're always open to feedback and learning more about what anyone thinks about these courses. But that is pretty much it for ours, if there's any questions or anything.
Haley and Yuli, this is Jennifer. Did you guys get an A on your assignment?
Yes, we did.
Okay, I would say you probably got an A plus, maybe.
And then I think our link, I did see someone tried to access it. I can't see who, it's all anonymous, and it said that it didn't work. So we will send out the link to the survey after this. Or I can probably add it. Thank you everyone in the meeting chat too. That's really appreciated.
This is Jennifer again. I have a quick question. So what are the next step for you? I know this was an assignment, but is the school actually going to follow through with some of your suggestions, or what are next steps?
We are really hoping that it will. We still need to communicate more with the nursing faculty. Specifically Ellie, I think was her name. So we are trying to communicate with her more, and we are hoping that it'll get implemented, but we are not sure as of right now.
We were in like the UMSL newspaper, so that did get kind of the ball rolling and more exposure to our certificate, so that was very helpful. They reached out to us just about information about the course that we took, the like honors course, and then our project, so that got us more exposure, and we had like some people talk to us about it, and then they recognize, well, I don't know if they recognize Haley around campus, but they've recognized me around campus and they've asked me about it. So it is good for people, for more people to know about it, and then maybe that'll influence the departments to help us implement it as well.
Do we have any other questions? I know some of you on this call, I know you've got to have some kind of questions. So anyone else have questions?
No pressure or anything. It was a lot of fun to get to present in general.
Proud of the work you guys are doing. Good job.
And then Jennifer, I think I just sent you the link to the form, so hopefully that is there.
Yes, I will put that in chat right now. Did you try doing that? No, it wasn't working. Or we'll see if the chat, if I just put the link in the chat, but if you need me to send it to you separately, just let me know. All right, we don't have any other questions. Well, Haley and Yuli, we really appreciate you spending a Friday afternoon with us. And I guess I should know this, but is your spring break coming up?
It's the last week of March.
Okay, so it says, I was thinking maybe it was next week. I'm like, wow. Very impressive to spend the Friday before spring break with us. Well, in a couple weeks then. Well, thanks again. And again, if anyone has questions, you've got my email, reach out to me and I can get you Haley and Yuli's emails as well. Everyone have a blessed afternoon and we will talk to you later.
Thank you.
Thank you,
Thanks.
ladies.
Thank you.